Hi, everyone. Today I have with me Betsy Thurston, who is a registered dietitian and eating disorder clinician who has a private practice outside of Atlanta, Georgia, where she helps people with any type of stressful eating experience. She works with many people virtually as a nutrition therapist and coach. And she also hosts her own popular podcast called Binge Dieting. Awesome. Welcome to the show, Betsy.
Well, hello. Thank you for having me.
And thank you for having me on your show way back when. It's been a while. It's been a minute, as they say. So can you start by just telling us a little bit about what is internal family systems work and why is that even relevant to eating disorder work? Like, why were you interested in that?
Well, I found internal family systems work for my personal stuff. So maybe 10 years ago, when I was having some I had a lot of fears, I had a lot of rumination, I had some obsessive thinking, and I wasn't at peace at all. It's very, very different from a lot of other modalities because it's very experiential.
Okay.
And the reason I love the model of internal family systems is the approach, the modality would be, for example, let's say you overeat and you're really upset about it. The example would be, let's see if we can find the part in you that's reacting. Mm-hmm. Stop, pause, drop into the body, sensing it, seeing it, hearing it. And it's a very different experience to say, who's there? Who is this part in you? What this thing, this energy? Mm-hmm. What is that like? And then it is, well, let's ask that part. What's it like for her? Maybe it's a part that is terrified. Well, now I was doing work with this, a few hours ago, and it was a brand new client, and she didn't understand this overeating. And instantly she connects with a part. What's it like? Well, my husband won't approve of me. Well, my husband's going to judge me. Well, my husband, I need to make sure he's happy. So instantly there's two parts. Now I'm realizing, so she has one part that is people pleasing and desperate that she's not safe if her husband doesn't like her. But there's a second part that now wants her to eat to soothe. Well, actually, that happened later, so I guess it didn't come up in that example right away. But in any case, it's a very, very different experience.
So let's say she identifies that part of herself that wants to please her husband and make him happy. Now, what do you do with that?
And I might say, well, let's see if we can get to know that part a little bit better. Mm-hmm. And so let's, if you're comfortable closing your eyes, I would say that would be very helpful to kind of go into this inner journey. And perhaps I might say, depending on a lot of variables, so see yourself in a situation where you're triggered and there's maybe a panic there. Oh my gosh, I need to please him. He's not pleased with me. Turn towards the panic. Can you see it? Is this thing in you aware that you're there with it? And so it's about, tell this part in you that's panicking or worried that you want to learn more about it and you want to get to know it a little bit better. So here's a big difference. It's an asking. Mm-hmm. It's a part, I want to know more. Mm-hmm. It's really easy for us to go into being mad at the parts and saying, I should be authentic and I shouldn't care what he thinks. Mm-hmm. This would become, I should get over that. Why should he matter? And I should be stronger. And in that instance, you would say, oh, wait a minute, there's another part that is just popped in, that is kind of mad at you for being that way. Well, see if that part could just step back a little bit and give you some room. Maybe if we have time, we'll go back to that part. See if it's okay with that part, if it would step back. And now let's go back to the part that's very panicky and worried about your husband. And let's just see what else it might want us to know. And it's a very big exploration.
Yeah, kind of a communication with the different parts of self. So in this particular instance that you gave us, the person who is a new patient who wants to please her husband, how did that exploration help her?
Oh, she said it was a game changer at the end, because the reason it helped her is because she knew that she had been overeating and binge eating, but she never really could understand the depths of why. She knew it was very important that her husband look at her and she appeared thin and fit. Mm-hmm. She knew that, but she didn't connect the dots that was such a great need. This was an extreme part. Mm-hmm. And so this parts therapy thing is about finding the parts that get forced into very extreme roles. It was an extreme need for her husband to look thin and fit for him.
Does this come from somewhere else, though? Like, could that extreme part be actually apart from her childhood?
Totally.
Okay. For me, a lot of it goes back to the child's self. And so all of these parts like perfectionism or people pleasing and so on, that part of self often arises in childhood. And, it shows up in our adult life as wanting to please a husband, whereas as a child, it may have shown up as wanting to please a father or a mother or someone else important in your life.
But there's a whole intricate process. But in terms of the inner child wound, that's a different part. And all those different wounds, connecting to them really by finding that inner child in a really deep way and really sitting with it and listening to it and asking it what it needed. So in that way, it would be similar, but I think to inner child work, but it's just such a big, intricate, nuanced system. And what happens as you start doing it, I don't know if you remember those Russian nesting dolls.
Yeah, right. Yeah.
One inside another. And so what we learn as we do this work is we thought it was just, I just eat to soothe, or I eat for this one reason.
Or I eat to please my husband.
Or I eat to, yeah. And we think, well, that's it. Okay, I'll heal that. But then we realize, well, wait, the inside of that is another need when I was much younger. And inside of that is even another need. It's another part. I wasn't loved as much as my brother. Yeah.
Well, for example, we just went through the holidays, and so many patients who are doing really great, or clients that I've worked with in the past who've done really great, and then they go home and somebody makes a comment about their size or about what they're eating, and all of a sudden they are thrown back in time to, feeling like, oh, I have to lose this weight. I'm not attractive unless I lose this weight, or the new politically correct term is I'm not healthy unless I lose this weight, right?
That's hilarious. You are so right.
Why do you find that hilarious?
I don't know, because it's politically correct. It's like, okay, we're not allowed to talk about appearance, but we'll talk about health, but it's equally dysfunctional when it's extreme.
Exactly.
That's hilarious.
Yeah.
Oh, that's funny. All right. So what do you do? So if you have been doing this work as homework in between sessions, or then it's much easier to connect in the moment with the part that is triggered. And in that moment, you kind of take a second and realize, oh, there's that scared little girl.
Yeah.
Or there she is. and you've already worked with her enough. And so you go to her in some way and you sit with her and you help her but a lot of the process of internal family systems eventually is what they call this unburdening, where you will be with these parts, maybe the little girl who's triggered, and update her and reboot her, but really make sure you understand what she needs.
Yeah.
And then you would transport her out of that time. You would say, go hold her hand and take her out and say, where do you want to leave? Do you want to get out of this time? Because you're not here anymore. The past is over. It's done. And you bring her into maybe a safe place where she feels like she's understood or safe or not judged. And so if you've done that work, and even if you've done just a little bit of it, you can, in the moment of a trigger at a party or at the holidays, you'll be able to go inside and just sense into, you're reassuring her. I'm with you. I get it.
Yeah, I'm with you. I can take care of you now.
Yeah, right.
Well, I love your work. And I also am a big fan of inner child work. And so I'm kind of one of those junk house dogs. I use a lot of different things in my work, it's not a junk yard dog. It's more like a pound puppy. I have a bunch of different lineage.
Modality. Yeah.
Yeah. Every day that I'm above ground is the best day of all. So, Betsy, it's as always a pleasure to speak with you. And thanks for all your time in explaining your passion for IFS. And I look forward to talking to you again soon.
Oh, yay. Okay. Thank you so much. I appreciate it. It was fun.